Hello, my name is Kelsey Davis. I am a student at the University of New England, and I am finishing up my Master's of Science in Applied Nutrition. Today, I'm going to talk to you about the systematic review I did on the presence of Bifidobacterium in the gut microbiome of exclusively breastfed or formula-fed infants. We're going to review the research and then talk about how to apply it in the field of nutrition. When conducting a systematic review, the initial step is to find a gap in data, research, and literature. Now, my background and interests lie within infant feeding, as I am a milk technician at Connecticut Children's Medical Center, fortifying breast milk and formulas. Where the gap in literature is actually the gut microbiome as a whole. It is widely understudied, and that is what got me into researching the gut microbiome of infants. So, my final research question is, in infants, does exclusive breastfeeding increase Bifidobacterium in the gut microbiome? So, what is Bifidobacteria and why is it important in the human body? So, if we take a step back for a second, your gut microbiota as a whole is made up of various strains of bacteria. This affects your digestion and sometimes the ability to absorb certain essential vitamins. Now, what affects the gut microbiota? One of them is infant feeding, human milk versus formula. Other things that affect the gut microbiota include birth mode, environment, gestational age, stress, medications, and dietary habits. So, why is this specific probiotic important? Short term, it helps your body digest while protecting it from harmful bacteria. It helps produce important chemicals included in B vitamins and healthy fatty acids. And most importantly, a lack of this bacteria has been associated with early systemic inflammation and immune system compromises. Research has associated breastfeeding with a higher level of Bifidobacterium in the infant gut microbiome. It is known that the first group of cultures that reach the gut microbiome of newborn infants can possibly determine lifelong immunity in physiological events that affect the host for the rest of their life. So, what do we do with all of this information? We conduct research. So, I conducted a systematic review comparing breastfeeding to formula feeding when it comes to the abundance of Bifidobacterium in the infant gut microbiome. I had to determine inclusion and exclusion criteria for the literature. I then narrowed down relevant literature, screened and analyzed each study, and rated them for quality. Sometimes this means that a longer term study is more valuable than a short term study, but not always, because the amount of participants and the population size has implications for the research. And so once I rated all of these quality studies, I reviewed the methods and results from each of those papers. And here's what I found. These results are very interesting, at least I think so. So we looked at many studies published within the last year or two. So we're looking at 2021, 2022 research. And what we found is that 11 out of the 16 studies found that breastfeeding does in fact increase Bifidobacterium when compared to formula-fed infants. This is consistent with previous systematic reviews done in, I believe, 2019. However, there are some notable components to this research. So when we look at the other 5 studies that found that the gut of a breastfed and formula-fed infant were comparable, 4 of them were quality studies, and they used formula that was fortified with pre and probiotics. And they found that Bifidobacterium abundance is similar to those of infants who are breastfed. So, what does this mean for the nutrition industry? At baseline, we saw that 11 out of the 16 studies concluded that breastfeeding is recommended when it comes to Bifidobacterium abundance in the gut microbiome. Now, the world Health Organization and UNICEF recommend exclusive breastfeeding within 1 hour of birth through at least the first 6 months of life in order to improve child survival, promote healthy growth and development. But we also know that about 44% of infants were exclusively breastfed worldwide between 2015 and 2020. We certainly want to increase that number, but my findings are consistent with big organizations that breastfeeding remains the number one recommended feeding practice. However, when breastfeeding is not an option, this evidence supports the use of formula fortified with pre and probiotics as an alternative to human milk for abundance of this valuable bacteria. We recognize why this information matters for infants' long-term health, but as we look to apply this information, we need to talk about who was impacted. We were talking about breastfeeding as a whole. There are many projects and organizations that are looking to increase exclusive breastfeeding, but when that is not an option, what do we turn to? Registered dietitians and lactation consultants, specifically working in maternity and pediatrics, have the option to take this information and apply it to their clinical field. We also have breastfeeding educators, various breastfeeding courses through WIC, Women, Infants, and Children, or hospitals where this information can actually be applied on a case-by-case basis. The Centers for Disease Control and Prevention is just one source where mothers or parents can find formula information. These resources should be updated with new research and formula recommendations that contribute to gut microbiome diversity. This is a very simple and easy way to take this research and apply it into real world perspectives. And that's offering resources for mothers and caretakers to make informed decisions. Additionally, there are a number of classes through local resources and hospitals that offer nutrition education for infants and mothers. And while, again, it will always be the number one recommended feeding practice to exclusively breastfeed, this is a space for caretakers to question nutrition educators. We talk about different feeding practices, what alternatives to breastfeeding looks like, regardless of the situation that you're in. And then this will allow individuals to make informed decisions for the health of their infants. Finally, we will talk about infant feeding in clinical settings. This is where my initial interest sparked, working as an infant feeding technician at Connecticut Children's Medical Center. Working with registered dietitians and lactation consultants, I learned a lot. But one of their jobs in the healthcare industry and as a clinician in general is to adapt to the latest research and apply that as they see fit. Now, I want to say that I was fortifying the majority of human milk, donor human milk, and formula for neonatal ICU patients. I want to exclude them from the conversation. This research only looks at healthy infants because neonatal ICU infants can't necessarily have added bacteria in their formula because of their conditions, illnesses, and infections. However, with an infant in the nursery, obviously by a case-by-case basis, a registered dietitian or a lactation consultant can choose a formula recipe if a mom or donor human milk is not available that is fortified with pre and probiotics, and that will possibly allow for stronger immunity throughout its life. Of course, we are almost always going to conclude with there is room and need for further research. Specifically, longer term studies, we want to look at infant feeding practices and health outcomes over a lifespan. Also within minority communities, infant feeding is incredibly understudied, and the gut microbiome as a whole, we are still learning so much about. And I think as we progress, we will advance our research and may find that our infant feeding practices change a bit. Thank you so much for listening to my presentation. If you have any questions, please let me know. And here are my sources. Have a great day.